Trastuzumab is used to treat a certain type of breast cancer that makes more than usual amounts of a substance in your body, HER2 protein. It belongs to a class of medications known as monoclonal antibodies and works by slowing or stopping the growth of cancer cells. This product also contains hyaluronidase, which helps your body absorb trastuzumab when given by injection under the skin. It is important to note that this product is not the same as other trastuzumab products and should not be used in place of each other. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. This medication is administered by a healthcare professional through a slow injection under the skin, typically taking 2 to 5 minutes, and is usually given once every 3 weeks. The injection is administered in the thigh, and the injection site and side are changed each time to minimize skin injury. The dosage of this medication is determined based on your medical condition and how you respond to the treatment. It's important to use this medication regularly in order to experience the most benefit from it. To help you remember, mark the days on the calendar when you need to receive the medication. Serious reactions, including an allergic reaction, may occur after your injection, usually within 24 hours after your dose. However, careful monitoring can decrease your risk. If you experience symptoms such as fever, chills, flushing, headache, nausea/vomiting, coughing, chest pain, trouble breathing, itching/swelling, especially of the face/tongue/throat, dizziness, weakness, or feeling faint, seek medical help immediately. Your doctor may also prescribe other medications, such as acetaminophen or diphenhydramine, for you to take before each dose to help prevent serious side effects. Be sure to follow your doctor's directions carefully. Some common side effects of trastuzumab 600 Mg-Hyaluronidase-Oysk 10,000 units/5 ml subcut solution include redness/irritation at the injection site, diarrhea, muscle/joint/back pain, stomach/abdominal pain, trouble sleeping, mouth sores, and loss of appetite. You may also experience headache, nausea, and vomiting, which can be severe. Your doctor may prescribe medication to help with these side effects. It's important to tell your doctor if you experience bone pain, numbness/tingling, changes in mental/mood, or a fast/pounding heartbeat. This medication may raise your blood pressure, so it's important to monitor it regularly. Contact your doctor immediately if you experience weakness on one side of the body, trouble speaking, vision changes, or confusion. This medication may lower your ability to fight infections, so watch for signs of infection such as a sore throat, fever, chills, or a cough. Let your doctor know if you develop a rash, as it could be a sign of a serious reaction. In rare cases, a serious allergic reaction may occur, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Trastuzumab 600 Mg-Hyaluronidase-Oysk 10,000 units/5 ml subcut solution can have serious effects on the heart, including heart failure. The risk of heart problems is higher if you are also using an anthracycline, such as doxorubicin. If you experience symptoms of heart failure, such as shortness of breath, swollen ankles/feet, unusual tiredness, or sudden weight gain, it's important to inform your doctor immediately. There is also a risk of serious breathing problems, which can be potentially fatal, usually during or within 24 hours of the dose. If you experience coughing or difficulty breathing, seek medical help right away. It's crucial to note that trastuzumab can cause serious harm to an unborn baby if used during pregnancy. It's important to discuss reliable forms of birth control with your doctor if you are considering this medication. The daily dosage and optimal timing for trastuzumab 600 Mg-Hyaluronidase-Oysk 10,000 units/5 ml subcut solution will be determined by your doctor based on your specific medical condition. Be sure to follow your doctor's instructions carefully for the best results. Before using this medication, make sure to inform your doctor if you are allergic to trastuzumab or hyaluronidase or if you have any other allergies. Also, let them know about your medical history, especially if you have had previous cancer treatments or any heart, lung, or blood pressure problems. This medication may increase your risk of getting infections or make current infections worse, so it's important to avoid contact with anyone who has a contagious illness. You should also talk to your doctor before getting any vaccinations while using this medication. Trastuzumab may cause dizziness, so it's best to avoid alcohol or marijuana, and not to drive or operate machinery until you can do so safely. Before undergoing any surgery, make sure your doctor is aware of all the medications you are using. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as this medication may harm an unborn baby. Reliable forms of birth control should be used while using this medication and for 7 months after the last dose. It is also important to consult your doctor before breastfeeding while using this medication and for 7 months after stopping treatment. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Also, it's important to note that trastuzumab is very similar to trastuzumab deruxtecan and trastuzumab emtansine, so it's important not to use a trastuzumab deruxtecan or trastuzumab emtansine product while using a trastuzumab product. Be sure to follow your doctor's instructions carefully to ensure the safe and effective use of this medication. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. Before starting or while using trastuzumab hyaluronidase, make sure to undergo necessary medical tests such as heart exams, complete blood count, and blood pressure monitoring. It is important to keep all medical and lab appointments to ensure the medication is working effectively and safely for you. Remember, it's crucial to take this medication exactly as prescribed. If you happen to miss a dose, make sure to consult your doctor or pharmacist for a new dosing schedule. This medication is usually given by a healthcare professional in a hospital or clinic setting. It is not meant to be stored or administered at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.